Organized Biology here, and we're talking congestive heart failure treatment in this video. So I'm going to divide this into two main ways. Number one is the medications you would provide a patient with congestive heart failure, as well as the education, because education is just as much of treatment as the actual treatment is. So let's get started. So first off, we're trying to fix two main issues with congestive heart failure. As you've seen in the previous videos, we have a fluid overload in our heart because we're not efficiently pumping the blood out, and it's pooling either in the body or the lung. So there's an issue with fluid overload, and the heart itself is weakened. It's compromised, so it can't efficiently pump blood out of it. So therefore, when we're thinking about our treatment and our education, it's going to be along the lines of keeping these things fixed up. So check this out. The three medications I'm going to talk about, right? ADD, that's how you can remember it, are the following. We've got antihypertensives, we've got digoxin, and we have diuretics. And we're going to delineate out diuretics as potassium sparing and potassium wasting. Well, what are antihypertensives? Well, hypertension means high blood pressure. And obviously anti means against it. So these are medications that are actually going to lower the blood pressure, okay? And the two types of antihypertensives that you'll likely give are going to be ACE inhibitors and beta blockers. Now, to learn more about these two specific blood pressure medications, I'd recommend that you hop over to my blood pressure medications episode where I talk about these different medications, how they lower the blood pressure. But in general, what are these going to do? Well, if we are decreasing blood pressure, one of the main ways we can decrease blood pressure is basically decrease the amount of pressure that's actually being forced back on the heart, right? This is caused by what's called vasoconstriction of these arteries and arterioles. So what are the arteries? Well, when the blood is forced through the heart, it's going to have to pass through these arteries, and these arteries have to stretch, okay? But sometimes with people with congestive heart failure, these arteries have been narrowed. Okay, so if we narrow those arteries, well, now the blood that's being ejected from the heart has to be forced into a small little tube, then that increases pressure, and that increases the strain of the heart trying to overcome that pressure by pushing up against those arteries, okay? So if we decrease the amount of pressure on those arteries, the blood can get out into the arteries a little better, so therefore the heart won't have to work as hard to get the blood out, okay? So that's the reason behind decreasing blood pressure with these antihypertensives. Secondly, digoxin. Okay, digoxin is actually going to attack the second part of a weakened heart. Digoxin allows for the ion calcium, okay, to stay present in the heart muscle itself. So it's going to increase calcium amounts in the heart. And if you've watched any of my videos about muscles or heart, we know that calcium likes to contract. So specifically, whenever calcium is present in the heart muscle will contract well, okay? So think about it. If digoxin is going to increase the amount of calcium in the heart, that is going to allow for a more efficient contraction. And if it's more efficient of a contraction, more blood will be ejected, right? Which was the issue in the first place. We weren't getting enough blood ejected with congestive heart failure. So once again, this will increase the efficiency of the heart. Great, so that's digoxin. Well, then we have diuretics, okay? Anytime you're talking diuretics, we're going to be talking about losing more fluid through urine. That's what it literally means to diurese something, is to pee it out. So this is going to specifically act on the kidneys and tell the kidneys to excrete out more fluid, right? So that is going to fix that problem of fluid overload, right? So all of these medications are obviously either decreasing the fluid or helping the heart out because it's weakened, right? Now, with diuretics, I want to key you into something. They are either potassium sparing or potassium wasting, okay? Potassium is usually shown as K+ because it is an electrolyte, okay? And the problem with some diuretics is that they can actually pee out a lot of potassium, and you can be what's called hypokalemic. And hypokalemia basically means low potassium in your serum, in the blood plasma, okay? So if you're using certain diuretics, these diuretics are going to force fluid out, but also potassium out. And those would be called potassium wasting diuretics. These are things like hydrochlorothiazide, as well as furosemide. So again, these are diuretics that are going to pee out the fluid with potassium leaving the body as well. And that could lead to hypokalemia. So if we're testing our patient and they do have low potassium levels in their blood serum, we're instead going to use what's called a potassium-sparing diuretic, something like spironolactone. Spironolactone will basically pee out more fluid, but it will hold onto the potassium in your blood serum, thus negating hypokalemia. And I always remember spironolactone is sparing, potassium sparing. Great. So with diuretics, remember, why are we getting this fluid out of the body? Why are we peeing more out? To put less stress on the heart by decreasing our blood volume, thus decreasing the amount of blood that the heart has to pump out, thus decreasing the stress on the heart. And they're also very helpful because a lot of the times you'll have what's called edema, depending on which side of the heart is failing, either in the pulmonary, in the lungs, or fluid buildup in the body tissues, like in the lower extremities. So diuretics are really, really good at pulling that fluid out, drying out the body in a way, and pulling it out through the urine so you decrease the amount of edema that you have. Wonderful. Now, education. First and foremost, people with heart failure should not go for a dead sprint because their heart's not very efficient, but you do want to encourage light, moderate activity followed by rest. These patients should not just be laying around doing nothing all day. They should be moving here and there. They're trying to train that heart to work again, right? But it should also be followed by rest in case the heart gets a little stressed out. Now, the second thing, while they are laying down, you do want to elevate their head. And this is just because it allows for more fluid to drain properly because of gravity, so that you don't put any extra stress on certain blood vessels, especially in the head.
And also, did you know that raising your patient's head helps them breathe a little better to diminish any sort of pulmonary symptoms they could be experiencing? Do you know what can make you breathe better? Subscribing to Organized Biology. Because if you watch more of this channel, you will learn so much and you'll breathe easier on your next test. Now back to Mr. J with that polo.
Next thing and most important, you do need to tell them to decrease their fluid intake. Because the more fluid they take in, the more obviously fluid they will have in the blood supply, and therefore it'll basically negate the process of these diuretics here. So we want to decrease the amount of fluid, and therefore you also want to decrease two other things related to both antihypertensives as well as diuretics. So the two things you also need to restrict are sodium consumption and cholesterol consumption. Cholesterol just does a great job of sometimes clogging up the arteries because it's a fat and it kind of pushes away the fluid. It can cause extra stress on those blood vessels, those arteries especially. And with sodium, sodium is like salt, right? And so it'll actually draw fluid towards itself and allow you to hold on to that fluid more. And it'll actually tell your kidneys to absorb more fluid as well. So once again, all of this would increase that fluid and we don't want that. So restrict those things. And last but not least, tell the patient to monitor their weight changes. People with congestive heart failure can gain weight very quickly, but it's mostly just fluid buildup, right? So if our patients are gaining several pounds a day of just fluid, that's an indicator that the heart failure is really exacerbating itself, right? It's getting even worse. Now, once we get them on these treatment plans, they should begin to see a little bit of weight loss due to that loss of fluid, the loss of the extra edema, right, that's in those spaces. So therefore, monitoring the weight is a great way to see, hey, is our medication working well? And also, is the congestive heart failure getting worse? All right, next up, you guys, is talking about differentiating right-sided heart failure versus left-sided heart failure. And before you go, which one do you think is more common? We'll find out in that video here.